Dental Soundbites bonus content.
Hello, I'm Dr. Effie Ioannidou.
I'm Dr. Arnell Wright.
Welcome back to another bonus episode of Dental Soundbites. Today we are having an important conversation with Dr. Scott Tomar about a contentious topic in the headlines, water fluoridation.
This is really, really important to our community.
It is, yeah.
So I have a dilemma, right? And this is not anything jarring, so everybody relax. But my dilemma as a healthcare provider, so oral healthcare, is navigating this with my patients and then now deciding like where I stand. Like I am for fluoridation, but then my patients come in and they ask me all these questions and they present their research and their videos and their theories about it. So can you help me navigate this so that I'm even more equipped? I mean, the whole conversation has helped me 100%, but like, what would you say to a brand new doctor who just graduated, who has never had to combat this issue with a patient before? Maybe they are not equipped with like the language, the research, the confidence to have this conversation because it's such, it could be like a big issue, right, in practice. So I just want to like help everybody else who may be like, what do I do? Where do I go? What do I say?
Yeah, no, it's really a dilemma. I mean, you certainly want to be respectful to your patients, and gently
educate,
gently correct them. So they come in, they say, look, and they'll show you their cell phone. Look, this study shows, and you say, well, thank you for bringing that to me. I understand your concern. However, understand that there are scientists, people that do this for a living who, have the, they've studied in detail how to read the literature. They've looked at this study and concluded that, that bottom line conclusion really is not supported, because of the way they measured fluoride exposure really it's not a valid way, taking a drop of urine at one time during a pregnancy, when we know that fluoride levels in urine can vary dramatically depending on the time of day and what they ate the day before and the which part of their pregnancy. It's just not, we know it's not a valid measure of fluoride. And we know things like IQ are incredibly, incredibly difficult to measure in young children. Any of us who have had kids and have taken them to a psychologist will tell you it is almost impossible to get a valid IQ measurement on a 3-year-old, especially when you have 6 different research assistants in 6 different cities who have not been calibrated. And so you got measurements all over. And to think you can draw any kind of conclusion from that, people have looked at this and say, no, this is just not a valid conclusion.
Thank you for that.
My pleasure. Thank you both so much for the opportunity to be here.
Thank you so much. It was great. Thank you.
And if you like this episode, please share it with a friend. Then be sure to subscribe wherever you are listening so that you can get the latest episodes. We also want you to rate it, write a review, and follow us on social media. Bye, everyone.
Dental Soundbites is an American Dental Association podcast. Learn more at ada.org/podcast.